Hello, everyone. This is Nurse B with Buzzing with the B. Today's vlog is entitled Got Hypertension. You may need to take the COVID-19 vaccine. The purpose of this vlog is to discuss why people who have hypertension may need to take the vaccine. People who have hypertension or high blood pressure are at a greater risk of developing um, COVID-19 infection, dying from the infection, or experiencing more severe acute symptoms. This may be the reason that Black people are more likely to require the use of the artificial ventilator or die from the disease. Before I go any further, I want to direct your attention to the icon floating over me in the corner. If you want to follow me, please press the subscribe button at any time during the video. I want to start with the question, what is high blood pressure or hypertension? The latest parameters starts hypertension with a systolic blood pressure, which is your top number, of 130 to 139 over a diastolic pressure of 80 to 90 millimeters mercury. The top number, or systolic number, is the pressure in your heart when your heart contracts and pushes blood out of your heart and throughout your body. The bottom number, or your diastolic pressure, is the pressure in your heart chambers during its resting phase, right before a contraction. The next thing we need to talk about is the prevalence of hypertension in the United States. 74% of African Americans may have high blood pressure, whereas non-Hispanic white people, 63% of them present with hypertension. But what causes high blood pressure? Well, there are 7 factors that may cause hypertension. Genetics is something that you really can't do anything about. If you have a family history of it, then you may have hypertension. Environmental factors are things that you can actually work on. Environmental factors include obesity, stress, and depression. The other 5 factors are internal problems within your body that stem from your central nervous system, cardiovascular system, renal or kidneys system, gastrointestinal system, or your endocrine system. For the purpose of this vlog, we're going to look at the cardiovascular complication that pertains to the renin-angiotensin system. This picture looks complicated, but I'm going to explain it to you in a simple way. In response to a low blood volume as determined by your heart, your kidneys will release a chemical called renin, which acts upon another chemical released by your liver called angiotensinogen to convert it to angiotensin 1. Once you have angiotensin 1 produced, the lungs will secrete an enzyme called angiotensin converting enzyme to convert it to angiotensin 2, which leads to the release of aldosterone, which causes the retention of sodium and water, or salt and water. Now, once your blood volume gets to a certain point, the renin-angiotensin system is supposed to turn off. But something happens in many people who have high blood pressure is that that system does not turn off, and you continue to produce renin that leads to retention of sodium and water and raises your blood pressure above a normal range. Now, what a lot of people don't know is that that angiotensin converting enzyme comes from your lung. That is why some people who take a drug called an ACE inhibitor will develop a cough. And they will have to change their blood pressure medicine. That's just a little tidbit for you to know. Now, let us talk about what happens when you develop a COVID-19 infection. Well, the virus enters your body and travels through the bloodstream into your kidneys. Once it enters the kidneys, it will act in this phase between the angiotensin 1 conversion to angiotensin 2. What it will do is that the spikes on the COVID-19 virus will attach to the transmembrane of the angiotensin converting enzyme like a puzzle piece. You fit right in that slot. This will give the COVID-19 a direct pathway to your lungs. Once it gets into a normal lung, it will cause some type of damage. The immune system will recognize that this virus is in place and will send in a large number of macrophages to attack the virus and kill it, as well as cytokines to attack the virus. Now, what happens to some people is that they will have an autoimmune response, whereas the immune system no longer recognizes the lung tissue as a part of their body and will begin to attack the lung tissue. When that happens, you develop a cytokine storm. These interleukins will actually attack the tissues of the lung and cause damage. The macrophages will cause a massive flooding of the alveoli with fluids. The alveoli is where you have the exchange of carbon dioxide and oxygen. This can no longer occur. This fluid will accumulate in the lungs, especially the lower portion of the lung, and start having an obstruction to your airway. You can no longer breathe because you have these thick secretions that you can't get out. So what will happen is that you will have to go on an artificial ventilator. The artificial ventilator will force oxygen down your airway into your alveoli so that you can have an exchange of oxygen and carbon dioxide. So an important thing to know is whether your hypertension is caused by the renin-angiotensin system. And one way to determine that is look at your antihypertensive drug that you are taking. Now, there are several types of antihypertensive drugs, but right now we're going to focus on the antihypertensive drugs that are related to that renin-angiotensin system and affect it. And those two types of drugs are your ACE inhibitors, which is angiotensin converting enzyme inhibitor, and your angiotensin receptor blockers. Now, you can tell which one you are taking by looking at the generic name of your drug. ACE inhibitors have a generic name that ends with the syllabi pril, whereas angiotensin receptor blockers end with the syllable sartan. Now, ACE inhibitors include drugs like lisinopril, enalapril, and ramipril. Ramipril is the drug that I take to control my high blood pressure. Angiotensin receptor blockers include drugs such as losartan, irbesartan, and candesartan. This is how you can determine whether you are taking medication for high blood pressure that is caused or by that renin-angiotensin system. If you do not know whether your hypertension may be caused by the renin-angiotensin system, take a look at your medicine bottle. I have posted a picture of my medicine bottle. As you can see, I take the drug ramipril, which is an ACE inhibitor. It ends with the letter pril, the syllabus pril. this is the generic name. The brand name of this drug is Altace, but many drugs have different brand names, but they will always have one generic name. So you need to remember the generic name of your drug. So people who have hypertension, especially if you take one of those two types of drugs I talked about and that affects the renin-angiotensin system, you might want to consider taking the COVID-19 vaccine, because that is one of the routes for infection in your lungs. I know that I will take it when it becomes available to the public. I can't take it right now because I'm not working as a nurse, but I will take it once the public availability occurs. In the meantime, and after you take the vaccine, if you decide to take it, continue to practice precautions that decrease the transmission of the COVID-19 disease, such as washing your hands frequently for 20 seconds, social distance of 6 feet, avoid touching your eyes, nose, and mouth. Use a face mask when you leave your home and go into other homes, houses, or buildings. Stay at home if you are well, and stay informed of the symptoms of COVID and any changes in the COVID-19. I want to thank you for joining with me, Nurse B, Buzzing with the Bee. I hope that you have found this video to be informative and helpful for you. If you want to follow me, please press the subscribe button that is floating around in the corner. Remember, this vlog is for healthy living purposes only. You need to see your doctor and talk to your doctor about taking the vaccine and whether or not you are a candidate for it. If you want to follow me, you can also go to my webpage, nurse-b.com. Thank you.